Hello, this is Dr. Brian McDonough. Welcome to Coronavirus Today, the Dr. Brian McDonough Show, a doctor in the pandemic. We are looking at numbers through Johns Hopkins University, and right now in the world, there are 6,276,889 deaths as of Sunday, May 22nd, 2022. In the United States, 1 million mark has been shattered. We're now at 1,002,173 deaths. Obviously, COVID is still here and with us. What are the concerns right now as I see it? Well, the biggest thing is a lot of people are not wearing masks. And if you've been vaccinated and you are in a low risk group, I wouldn't be too worried, except that understand that the virus is spreading real easily right now. We have a very transmissible virus. And if you wear a mask, you're less likely to get it. Are you 100% protected? Absolutely not. Just like you're not 100% protected if you have the vaccine. But if you can cut down that exposure, it's a great idea, especially if you live with someone who hasn't been vaccinated or is in a high risk group. And remember, children under 5 still are not eligible for vaccinations. That's a big group. A lot of children between the ages of 5 and 11 have not had the vaccine because of their parents' choice. And again, that's the parents' choice, but not necessarily the child's choice. So they're almost innocent victims of not being vaccinated if they're exposed. So anything you can do to reduce that exposure is helpful if you have a family member who's in that situation. The other thing I think is important is to talk about long COVID and kids. Children clearly from the very beginning, and thank goodness, have been protected from the virus to the large extent. We have had children hospitalized and children with some very serious illnesses. There have been those who have died, but a large percentage are doing quite well. But what we're starting to find is frightening. And that is even children who have been exposed and have gone out 12 weeks without symptoms are starting to develop symptoms of long COVID. Long COVID could be brain fog, joint pain, respiratory issues, mental status changes, all sorts of issues. And there is a fear that the inflammation from the coronavirus exposure might be causing this. We're studying this. We're going to be studying this for years. But the thing is, if you can reduce exposure for your child, it's only better. In other words, one less exposure, one less chance. All of those things are helpful. So don't just think, kids will get through it. No worry. You don't want to live in a bubble, but at the same time, you want to do what you can to protect your children. And of course, the best way to do this is the more we get people vaccinated and improve our vaccines, the more we have medications to treat people, and the more people test and stay home when they're sick, the reduced chances of exposure. So that's pretty much everything that's going on in a nutshell right now. We're in a good phase. Clearly, we're not past it. And clearly, we are seeing deaths in those who have not been vaccinated. We will continue to try to tell people to get vaccinated. It is a very safe vaccine. I mean, studies just and evidence is just showing that you're far better off to be protected. And we'll continue to work on these things. Otherwise, I think the most important point here is continue to live your lives as normal as you can, but understand this is another risk factor that's out there. Right now, cause of death in the world, it's in the top 3 all throughout the world. You're looking at heart disease, you're looking at cancer, and you're looking at COVID-19.